Well, let me congratulate all of you. I know today the president's taking bows, and rightfully so, and Nancy Pelosi and Harry Reid and those of us who helped write this bill in the Senate and the House, the members who voted. But I'd like to take a minute and to thank all of you out there who've made a difference. Without the backing support, people going around and knocking on doors and making phone calls and answering blogs or creating blogs, we wouldn't have never gotten to the point today, which has eluded every administration since Teddy Roosevelt, almost every administration, almost every Congress. Some have done better. Obviously, Lyndon Johnson with Medicare, Franklin Roosevelt in the 1930s with Social Security. We just did the Children's Health Initiative, which was helpful, obviously, in all of this. But all these other administrations, including Richard Nixon, tried to come up with a national health care plan and failed at it for one reason or another. And today we succeeded at something that's never been done before in our country. And no small measure of that thanks goes to people across our nation who insisted upon candidates that would stand up for health care, marched, called, wrote, did everything possible to help us make the case to the American people, despite the misinformation being marketed by hordes of lobbyists, millions and millions of dollars being spent by special interests to defeat this effort. So I want to begin by saying thanks. When that elderly person will start to fill that proverbial donut hole that's been costly to them and getting prescription drugs, they can say thank you to many of you. When that young person who's yet to find that job can still stay on their parents' health care plan until they're 26, a lot of thanks goes to you. When you see the tax breaks that go to small businesses that today would like to provide coverage for their employees because it's good for them, it keeps them working with them, a good part of the thanks would go to people out there who have made a difference. Those are the provisions that happen immediately, by the way, and there are others that will kick in. The caps on lifting the caps on what an insurance coverage can do, or throwing someone off their policies immediately. All of that happens immediately. That's great news for the American public. And so I thank all of you. I was proud to be involved in this. Senator Kennedy asked me to take over for him when he got sick. I would have loved to have had him with me today. Can you imagine the pride he would have had, having fought all of his public life for national health care, to be in the East Room of the White House today and watch an American president sign into law a bill that he had dreamed about for so many years. And so to be in his place, to be standing there today in his place, having managed this bill through the committee, is one of the highest honors I've ever had as a United States Senator. I'll be leaving in January, but I can't think of a better way to wrap up a public career in the United States Senate than to play an integral part in writing the first national health care plan for our country. I'm grateful to all of you for letting me be a part of that and for helping us get where we got today. Thank you.